Time is running out. The deadline to enroll in a healthcare plan through the ACA is only 1 month away from today. So what are you waiting for? We have experts to help you navigate the process. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services. And Laura Packard is with Get America Covered. They are all here to answer your questions about ACA, healthcare plans, insurance, and Medicare as well. Here's how you get your question to these experts. You're going to text those questions 336-379-5775. Remember, this is a text only, so please don't call. All right, Laura, first and foremost, let's start off with the deadline. We want to put it up on the screen, make sure everybody sees it and everything, so that they know what's going to happen August 15th.
Yes, as far as we know, the deadline for signing up for affordable health insurance through the ACA is August 15th at healthcare.gov.
And I love what you said, as far as we know, because we've had a lot of changes throughout this last year.
It's not impossible that they'll extend it, but don't count on that.
Okay, it's
the
not
deadline
impossible
for now is August
it.
15th.
Okay, August 15th is it. So we wanted to make sure that you guys got that. You know, it is 1 month from today. So a lot of times people go on the website and they are just overwhelmed with all of the things when they see all those plans. Morgan, we've talked before, but if this is the first time someone has been here, talking to an insurance agent about this is not going to cost them. In fact, it could actually save them money. So let's talk about that.
Absolutely. So agents should not be charging you any type of fee. We are paid commission, so that does not come out of your pocket at all. And we can help you navigate all of the plans and compare them for you. So we can double check to make sure your primary care physicians and your specialists are in your network that you're looking at. And we can also even do a deep dive and we can look at your medications to see exactly where they're at on each plan's formulary. So we're making sure you get the best bang for your buck.
Okay, and speaking about the best bang for your buck, Laura, if people are like, well, I guess my plan from last year is fine, I don't even want to go through the hassle, you would always say, yes, you need to take a look at it again, because why?
Well, there's a whole lot of new plans, and also the American Rescue Plan subsidies made existing plans a lot cheaper. So go to healthcare.gov and check it out again.
Okay, so again, we are taking your questions on ACA, healthcare, and health insurance as a whole. We're also going to be taking your questions about Medicare. And so Catherine Sevier is with AARP, and you guys have a brand new tool that can help with all the complicatedness of Medicare too.
Absolutely. So we've updated a lot of our information. So if you go to aarp.org/health/Medicare, there is an incredible amount of information there, and there are FAQs so that most of the common questions get answered.
Okay, and so one of the most common questions that is asked, and we're probably going to answer it maybe 5 times in the next 15 minutes, we'll see, is when do I sign up for Medicare? And there is a specific time that you have to sign up for Medicare.
Absolutely. And that, with all the things that are changing out there, has not changed one iota. 3 months before your 65th birthday, 3 months after, in the month of your birthday. So there's a 7-month window where you need to sign up. You need to sign up, and you need to understand that if you don't, and you don't take Medicare Part B, you are at risk for having a penalty for the rest of your life if you decide to take it later.
Right, and that whole Part B thing has been interesting. We've talked about it a lot. Morgan, a lot of people are like, yeah, but can't I just defer it? But you have to do some specific things.
You absolutely can defer it if you have credible coverage through your employer. You need to always check with your HR department to make sure that coverage is deemed credible. If not, you will receive a penalty. Also, you need to look at a prescription drug plan, the Part D, because if you defer that as well, you will be subject to a penalty when you do decide to enroll in a prescription drug plan. So both of that coverage needs to be verified through your HR department and deemed as credible coverage, meaning as good as or better than Medicare.
All right. And folks, don't feel overwhelmed with thinking to yourself, oh my gosh, I don't understand all this stuff. None of us know all of this stuff, which is why there are experts all the time that we go to and we talk to, and then their experts talk to experts. So that's okay to ask questions, no problem. Laura, this person is saying, are insurance premium subsidies taxable?
That's a good question, and you do have to. You have to include your income to find out what you apply for.
Okay.
But actually, I'll kick this over to Morgan to give a more detailed answer.
Health insurance premiums taxable, possibly through an employer, but not through the exchange or the marketplace. No.
Okay, they are not taxable income like an unemployment benefit or something of that nature. Okay, just wanted to make sure. And again, we're trying to answer all the crazy, complicated questions that we can for you. It's okay if we have to look stuff up in the middle time and we come back after the break and we figure some other stuff out. We're going to continue to take your text questions. We'll be right back in just a minute.